Hello, everyone, and welcome to the Becker's Health IT and Digital Health Spotlight. I'm Laura Dearda, and I'm really excited today to be interviewing Chris Carmody, who is the Chief Technology Officer at UPMC. Chris is a regular guest of ours on the podcast, has really contributed a ton to our digital content, and then is speaking at our Health IT Digital Health and Revenue Cycle conference in October. So we're really excited about that and want to give you a little preview into our discussion here today. Chris is going to spotlight for us some of the cool things that they're doing at UPMC. I know they have several big IT projects going on, including unifying their EHR system under a single instance of Epic. So I'm sure we'll talk about a good amount today. But before we dive in, Chris, just if you want to take a minute to introduce yourself and tell us a little bit about your background, we can do that and then dig into some of the cool things you're doing at UPMC.
Sure. Well, thank you for having me again, Laura. It's great to talk with you and share what's going on at UPMC. And just a little bit of background on me. I've been at UPMC now for just about 27 years. So it does not feel like that. But, I did start with a lot of hair back, 27 years ago, and have really been fortunate to be on this IT healthcare journey over that time frame and work on many different projects and have many different career opportunities. So where we're at today is very exciting space. I'm working on the most transformative project ever in my career, and I can see the light at the end of the tunnel right now. We're 121 days from our go live as we talk today. So there's a lot of excitement, a lot of great work and building blocks that have been put in place. Still a good runway away, but definitely can see that light at the end of the tunnel and the excitement and the engagement from our whole UPMC community that's engaged and excited about how we're going to take care of our patients moving forward.
Excellent. Well, I think let's start there. Could you tell us a little bit more about that EHR unification project and, really what it's taken over the last year or so to prepare and then get to this point where you're 120 days away from a huge, huge go live, a huge project that has implications for the health system for years to come. So what does that transformation look like from the technology as well as people side, and how are you, standing as we are talking here today?
It is not trivial. It's actually been a multi-year process just to get to this point. We had to do a lot of assessing, talking to different healthcare systems that have gone down this path. But something that's maybe unique to us at UPMC is we actually today operate 10 different main EHR systems across different parts of our organization. And a lot of that was through acquisitions and just connecting the different systems and connecting our patients. And quite honestly, for us on the IT side, we've been sprinting a marathon. We've been working so hard just to create this seamless experience for our clinicians. It just doesn't make sense. And we feel and see this great opportunity to leverage a single instance of Epic to help really enable that innovation, the scaling out of different new technologies to build off of this platform that we're doing. So we actually call the program our UPMC Bridges Project. So it is the name of the initiative, but it's also a metaphor for our mission to bridge all these disparate systems and regions and care across UPMC into one unified digital ecosystem so we can provide the best patient care to all the patients in the communities that we serve.
I love that. And, such a great visual in order to remind people what all this work is for and what the outcome is going to be. I'm curious, I know there's so many health systems right now that are either doing upgrades to their EHR or trying to figure out how they can, similar to your situation, bring together disparate systems. And so where do you start as a CIO or Chief Technology Officer, and in the teams that you're working with? How do you get that kicked off in the most successful way? And what have you learned over time to really understand how to make this as smooth as possible?
The biggest and best answer to that is it's not an IT project. It's not me. It's not our IT team. It's the organization that is stepping forward in unison to say, we need to do this for improving our patient care, for improving our environment so we can align our resources to apply them to do the next best thing as we move forward from a technology adoption perspective. I'm sure we'll get into talking about AI and generative AI, which is key to be able to advance how we deliver that care. But This is a team sport. This is not an individual sport. This is not IT telling our doctors and nurses and technical folks this is how you're going to do your job. No, it's partnering together. It's collaboration. It's communicating. It's decision making, all wrapped into one big program with a lot of great governance to make sure that we move forward collectively together. And that's where we see this huge transformation, to have a standard way to deliver care, and just some of the basic things that we take, some organizations may take for granted, but we've had to work around at UPMC. One of the crazy statistics that I like to share is we transact about 43 million ADT interfaces every 24 hours. So that's just to stitch all the patient records and data together in that day. And we have a great system, great team that makes it happen. But wouldn't it be better if we can redirect those talented IT resources to actually work on generative AI and have less of that data traversing, but more innovation and applying that to how we deliver patient care?
That makes a lot of sense and is really helpful context to understand what you're moving through and navigating. And, to your point, looking ahead about 12 months or so, how are you continuing to build upon the success you've already had, and how are your teams going to continue to evolve? I know it sounds like there'll be certainly things that'll become easier in areas where your IT team can lean a little bit differently. So I just am curious to hear from you. What do you foresee over the next 1 to 2 years or so in terms of how this project will unfold, and then what it will mean going forward from that point?
It's first of all, for me personally, it's super exciting, right? It's doing something so transformative, which is what I think we all strive for in our careers, to do something so meaningful. But from our team and our organization, some of the biggest things, the most important things, are the most simple things and the hardest things to do, like communication, right? Here's what this group or this work team is doing, for them to be able to communicate it and share if they have roadblocks and issues. How can we help overcome that so we can keep everything moving forward? That's some of the stuff that we have to continually get better at and lean on in order for us to be successful. Then you translate that into, how do we work with all our stakeholders out there that we have to engage and inform and educate and help them come over that sort of that wall of change, so they are accepting of it and they understand and process it and figure out how their job's going to be different from yesterday to today and into the future. And lastly, and the most important one, is our patient engagement and informing and educating them on some of the changes that may impact them as they come in and receive care at UPMC, and honestly have better open access because of one unified EHR platform to help enable that, and them not missing or skipping a beat in how we're delivering care to them. So communication's definitely a big piece of this. It's going to be instrumental in our success. It's been instrumental in getting us to this point. So as we go live with our first wave of about 20 hospitals and hundreds of sites, we still have half of our organization that'll be on the legacy systems. So there's going to be a delicate balance between, getting through that optimization phase at post go live and then ramping up for the next go live. And once we do that same sort of process there, it'll be great for everyone to take a deep breath and settle in. And then we turn on the jets and the burners to go after all the innovation that's possible. We're excited, not to change subjects a little bit there, but with our release of Epic that we're going live with, we're going to have 11 of their generative AI models built into our platform. So just that acceleration, that to include generative AI tools immediately is a great benefit, that we're not just taking them from the EHR they have today to another one that is similar. We're actually building upon that capability with Epic's help. And then we can build off of that with some of our expertise and what makes UPMC unique in the industry, and some of the other AI tools and analytical tools that we have and technologies that we have in this ecosystem, which, again, we're excited about on how that makes such a difference in our delivery of patient care.
Absolutely. And, that's amazing to hear, having already, as you mentioned, that generative AI capabilities that will be built into that new EHR that you're working on. I think AI is certainly a term that's been on the tip of so many leaders' tongues across the healthcare industry. And so UPMC, I know, is on the forefront and pioneering a lot with AI, has an infrastructure in place and really a more sophisticated kind of data management structure than many organizations. So from your perspective, when you're looking at these tools, this AI, are there still things that you see as being kind of cutting edge that you're doing right now, or capabilities over the next year or so as the EHR goes live that you're just really excited about on the AI front?
I think that the EHR product is going to make it a lot easier to adopt more AI, because instead of having to implement it in 9 different places, to do it once and more broadly, more scaled out for our organization is going to be a great win. But I am excited about all the capabilities with AI. I'm also cautious as well. I think we were very focused about making sure any technology, whether it's AI or not, that it has the highest level of integrity and security and privacy built into it. So we have a lot of processes and procedures and reviews, and we actually have an AI policy. We have an AI governance framework and model that there's a group of leaders that come together to review different AI proposals that come into UPMC to make sure they fit within our scope and mission, that it has all the right controls and safeguards put in place. Because as you know, AI is evolving, and it's going to continue to have its different, failures or opportunities, however you want to look at it. But we want to make sure that that's controlled and that we're able to, resolve anything that would arise. So we're very cautious and intentional about our process to make sure that we put the highest level of integrity of an AI model or platform at UPMC. And as you mentioned before, we're excited about some of the tools that we use today, like our ambient listening for our physicians with a bridge. No pun intended there. It's a different technology platform, but it was created out of UPMC, and it's pretty widely known across the industry. But having that type of tool to help relieve some of the cognitive burnout from physicians is a great tool, and helps create some efficiency for them. And that's where I see a lot of the AI, at least right now, coming out, that's going to be impactful to our organization and others in the healthcare space.
That's great to hear. And certainly, as you mentioned, looking at AI as a whole, being able to find those places where, the risk does exist. And so you can be very mindful of how you're applying that and installing, AI across the organization, being able to test it and move quickly, as well as continuing to be innovative. So it seems like quite a balance you have to strike there, and just finding the areas where you can have, are comfortable and confident in the technology, dealing with especially patient care and data and information.
Absolutely. You have to be very mindful of that and have to have all the right steps and processes to make sure you maintain that integrity.
Excellent. Well, I think, before we wrap up here, I wanted to ask, looking even 3 to 5 years in the future, what do you see as being possible because of technology that isn't possible today? I know, technology is accelerating at a pace that we, aren't used to in the healthcare necessarily. And certainly, I don't have a crystal ball, but would love to hear from your perspective what you see as being truly possible, 3 to 5 years from today.
I mean, again, this is Chris Carmody's personal view based upon what I see and what I experience. I think we're on the cusp of technology truly breaking down those 4 walls of being in a hospital, right? We talk about the patient at home and remote patient monitoring and telemedicine and patient portals. I think we're at the cusp of really leveraging that transformation to where not only are we going to make access easier, we're going to make it more broad, more scaled out, so people can actually be seen in a timely manner. They can be seen, when it's convenient for them, when they need to have that care, whether it's, a PCP visit or with the top specialists in the world. So I think technology is going to help continue to make the delivery of healthcare more efficient, more effective, and increase the quality of the outcomes of what we're trying to do. So I think we're so close. We're almost there to really seeing that transformation. And I think that's exciting. So an organization like UPMC is just going to be, brimming with possibility and opportunities and how we can touch people's lives, both on the care delivery side and also from an insurance services provider side to make it an overall better experience to give people better lives.
I love that. Well, Chris, thank you so much for your time today. This has been such a fun conversation. As always, I learned a lot and certainly appreciate the opportunity to speak with you. Grateful for this time and looking forward to seeing you in October as well.
Likewise, Laura, always great talking with you, and thanks for the opportunity for us sharing the story of UPMC.